How do you manage high fevers in children with flu? When a child has the flu and develops a high fever, it can be worrying for parents. Managing this fever safely and effectively is important to keep the child comfortable and prevent complications. First, it's essential to understand that fever is a natural part of the immune response. It helps the body fight off infection. Mild to moderate fevers, between 100 and 102 degrees Fahrenheit, usually do not requiring medication because they can be beneficial. The goal is to focus on reducing very high fevers that cause discomfort or pose risks. For fevers above 102 degrees Fahrenheit, medications like acetaminophen, which is found in Tylenol, and ibuprofen, available as Advil or Motrin, are recommended. These can help lower the fever and relieving body aches. It's very important to follow the dosing instructions carefully based on the child's age and weight. Never give aspirin to children because of the risk of Reye syndrome, a rare but serious condition. Do not give both acetaminophen and ibuprofen at the same time unless advised by a healthcare professional to avoid overdose. Also, be cautious not to exceed the recommended doses, especially since many cold and flu medicines contain acetaminophen. If the fever is very high, above 104 degrees Fahrenheit, and does not respond to medication after about an hour, a lukewarm sponge bath can help. Use water around 85 to 90 degrees Fahrenheit and gently sponge the child's body for 20 to 30 minutes. Stop if the child starts shivering or feels cold, as this can raise body temperature. Avoid using cold water or rubbing alcohol, as these can be harmful. Supportive care plays a key role. Make sure the child gets plenty of rest and encourage fluids like water, clear broths, or electrolyte solutions to prevent dehydration. Keep an eye on symptoms such as difficulty breathing, persistent vomiting, extreme lethargy, or signs of dehydration, and seek medical help if these occur. For children at higher risk of complications, such as those under 5 years old, especially under 2, or with chronic health conditions, antiviral medications may be prescribed by a healthcare provider. These medications can shorten the duration of illness and reduce the risk of serious complications if started within the first 48 hours of symptoms. Medical evaluation is especially important for infants younger than 3 months with a fever of 100.25 degrees Fahrenheit or higher, or for children aged 3 months to 3 years with a fever of 102.2 degrees Fahrenheit or higher. Any child showing signs of severe illness or difficulty breathing should be seen by a healthcare professional promptly. In summary, managing high fevers in children with flu involves giving appropriate doses of acetaminophen or ibuprofen, using physical cooling methods if needed, ensuring rest and hydration, and seeking medical advice when necessary. Avoid unproven or harmful treatments like aspirin or home remedies that are not supported by medical guidelines. Always follow the guidance of healthcare providers, especially when considering antiviral medications or monitoring for complications. Remember, every child is different, so personalized medical advice is always best.